Hi, my name is Dr. Olivia Joseph, and I would like to share my story with you. I have been practicing in the natural healthcare field for almost 15 years. But long before I ever decided on a career in healthcare, I had my own health issues that I would like to share with you. Because I know no matter how you look at it in this day and age, every one of us has been touched with some type of issue within their healthcare. A lot of people, more so now than ever, are frustrated with the health of our society and our current healthcare system. So a long time ago, some of my very first words were, my tummy hurts, my tummy hurts, my tummy hurts. So my mom did what any good mother would do. She took me to the pediatrician. And I remember it to this day. He prescribed a green medicine for me to take for my stomach pain. I still remember how terrible it tasted, but I took it faithfully. And after about 6 months, it wasn't helping. So my mom took me back to the pediatrician. At that time, he gave me a pink prescription medicine to take. Tasted equally as bad, and unfortunately, it didn't help me. But I took it faithfully for about 6 months because we were gonna be compliant patients. We did what the doctor said. Unfortunately, it wasn't helping me. So she took me back to the pediatrician again. And at this point, he said, it's not normal to medicate children. I think what your daughter has is a nervous stomach, and I think you should take her for counseling. So my mom did exactly that. At this point, I'm probably about 9 years old, and I started going to counseling to see if that was the cause of my chronic stomach pain that I had had for my entire life, or at least as long as I could communicate that. So I had been going to counseling for about 9 months. Driving home from one of my appointments, I was nervous to tell my mom, but I looked at her and I said, Mom, if you want me to keep going, I will, but my stomach still hurts. So my mom was very frustrated. And what she did when we got home was she called one of her best friends who was a family practice physician. He ran a blood test on me, testing me for a bacteria called H. pylori. H. pylori causes 90% of stomach ulcers. And sure enough, I had it. So how do we treat bacteria? Quite successfully using antibiotics. Now, currently you treat H. pylori with triple antibiotic therapy. That means 3 antibiotics. At this time, long time ago, I took 2 antibiotics and I was prescribed 2 other medications for the side effects I would inevitably have. And I was to take this medication for an entire month. I did so faithfully. I never missed a dose, and I can honestly say I was sick as a dog. I missed half the month of school because I was so sick, but I wanted to get better. I was willing to do whatever it took to get rid of this bacteria that was the root cause of my stomach pain. We went back and retested, and the medication worked. The bacteria was gone, but the problem is my stomach still hurt. So at this point, I was referred to a gastroenterologist. And at the time, there was not really such a thing as a pediatric gastroenterologist because kids didn't have as many ailments then as we currently have today. So I had to wait 1 year on a waiting list to see a gastroenterologist that was willing to take me because I was a minor. So at this point, I knew I wanted a career in healthcare. I knew I wanted to be a doctor when I grew up. I watched my mom have cancer 5 times from the time I was age 10 to about 25. I wanted to help people like my mother, and I considered a career in oncology. So I was already very inquisitive. I was asking a lot of questions. I was questioning my doctors and their recommendations. Now, I know sometimes doctors don't like that, but I actually advise you to do that, to do your own homework and do your own research, because ultimately you are the advocate for your own health. So I went in for an endoscopy. I was put under anesthesia, and when I woke up, I remember the doctor said to me, "We found out what was wrong. You have gastritis." And I was prescribed prescription Prilosec, which I was to take for 6 to 9 months. And I remember they said to me, it could take a while before it makes any difference, so just take it consistently and continuously. I took my medication faithfully, and it wasn't helping me. So I went to the school library and I went to an encyclopedia. This is before we had WebMD and we could Google all of our ailments. And I looked up gastritis, and sure enough, I did not have any of the symptoms. So I went back to my follow-up with the gastroenterologist and I said to him, "Doc, I looked up gastritis in the encyclopedia. I'm taking the medication you gave me and it's not helping. You misdiagnosed me. I don't have these symptoms." And he said to me, "I know what you have. You have irritable bowel syndrome." And he gave me a new medication to take. So I went to fill that prescription, and that prescription cost $700. My insurance wouldn't cover it because this is over 20 years ago, and IBS was not a real diagnosis at the time. So any medication to treat a diagnosis that wasn't real was considered experimental. So I don't know where my mom got the money. We were a working middle-class family. Both my parents worked, but somewhere she dished out the cash to pay for my prescription for 6 to 9 months because it could take a while for this medication to work. So I went back to the school library, back to the encyclopedia, and I found irritable bowel syndrome in there. And I did all my research, and I had none of the symptoms. No wonder this medication wasn't helping me. So I went back to the doctor and told him exactly that. And this is what he said. He said, "I know what you have. You have a nervous stomach." And I left the office with a Zoloft prescription. And for those of you who don't know what that is, it's an antidepressant. It's a psychotropic drug that is not approved for use in minors, and I was a minor at the time. So I started taking my prescription medicine, my Zoloft, for my nervous stomach because my entire life I've been a good compliant patient. I did what the doctor told me. I put faith in that system even though over and over it wasn't helping me. I remember my mother asking the doctors over and over again, could it be anything she's eating? Could it be anything she's eating? What should I be feeding her? What should I take out of her diet? And over I heard, this has nothing to do with diet. This has nothing to do with diet. At this point in my life, I'm living on dry cereal, dry toast, and plain boiled noodles. And my mom saw how skinny I was and how miserable I was. And she would make me put Alfredo sauce on my noodles, cream cheese on my toast, and whole milk, heavy cream, half and half, even buttermilk in my cereal because she was just trying to fatten me up. But everything I ate made my stomach hurt. If I didn't eat, my stomach hurt. So at this point, I'm a freshman in college. I started to develop severe side effects as a result of the Zoloft. And I call the doctor's office and I say I need to speak to the doctor immediately. I'm having a terrible reaction to this medication. They put me on hold and then the nurse picked up. I told her what was happening and she said to me, "Honey, you're just gonna have to tough it out." And I was on one of those cordless phones with the big silver antennas and I was so mad and frustrated, I threw the phone and it broke into pieces. And I just started crying. I remember exactly what I was thinking at that time. I remember thinking, I'm done. I'm done being poked. I'm done being prodded. I'm done with this healthcare system. I will not take another pill. I will not see another doctor. I am done. And I called my mom on another phone. And what she said to me was, "You're gonna get your butt home this weekend. We're gonna go to see one more doctor." And I said to her, "I refuse. I'm done with doctors." And I went home that weekend because she made me, and she took me to one more doctor, and I'm so glad she did, because that doctor ran a food allergy test on me. And what I discovered was the foods that I was eating my entire life were what was making me sick. It wasn't a diagnosis. It wasn't this bacteria, which needed to be treated, which was successfully treated with medication. It was my diet. I had reactions to gluten, dairy, potatoes, and corn. I'm a Polish girl. We eat potatoes every single day. If you think it's hard to avoid gluten, try avoiding corn. It's in everything. At this point, I'm a college student living on campus on a food plan, and I had to, on my own, give up these foods, and I did for 6 months, and my entire life changed. My ailments I had struggled with my entire life completely went away, and I'm happy to say have not returned. And long story short, I didn't become an oncologist. I didn't become a gastroenterologist. I decided to go into natural health care. And for the last 15 years, I have been honoring the philosophy that food is medicine. Food was making me sick, and I have used the appropriate testing, like food sensitivity testing and many other tests that I use clinically in my practice, and I've been using dietary and lifestyle modification in my patients and clients for over 15 years, and I have seen huge success and huge results, just like I saw in myself. So the reason I tell you this story is because I've been the patient. And what that has done is it's given me more compassion and more empathy in helping my patients. I'd like to leave you with this thought. Relief comes from your beliefs. I will say that one more time. Relief comes from your beliefs. We have some of the most amazing emergency medicine in the world. If you have an accident, if you have a heart attack, if you have a stroke, this is the country you want to live in. But if you want to be healthy, we're failing. We're failing especially when it comes to chronic diseases. Chronic diseases like gastrointestinal disorders. Issues with toxicity. We are exposed to more toxins than ever before in history, in our environment, in our food, in our water, through a lot of medications. Why? Because we allow those toxins into our system. We are failing when it comes to things like allergies, neurological disorders, cognitive dysfunction, diabetes, obesity. We have to accept responsibility for our own health. Don't give up, and don't let your doctors make you wrong for your beliefs. If your doctors don't share the same beliefs that you do, find new doctors, because as doctors, guess who we work for? We work for you. So if you're not happy with the results that you're getting, you've got to change your beliefs. Thank you for listening to my story.